So it's my pleasure to introduce Dr. Stuart Smyth. Stuart is, sorry, I need to check my notes to make sure I get this right. He is within the Department of Agricultural and Resource Economics within the College of Agriculture and Bioresources, and he holds an industry-funded research chair in Agri-Food innovation. And so, Stuart, I won't belabor the introductions. I will hand it over to you at this point, and thank you for delivering your talk called The Health and Social Benefits of GMOs.
I grew up in the province. I grew up on a farm about 100 miles southeast of Regina down by Moose Mountain Park. So it's a fantastic opportunity to be able to still be involved in agriculture through the research I do, and to have an opportunity to talk to you tonight, and thank you everybody for taking time out of your busy schedules to spend a bit of time with us this evening. So as Julia mentioned, I hold a research chair at the U of S, and research chairs are encouraged by the federal government. The way they're structured is that they encourage industry to put up half the funding, and then through matching programs, the federal government puts up the other portion of funding. Mine's a little bit different than that. I've got funding from the Global Institute of Food Security, so it's the public source. I've got private funding through Bayer and Syngenta and CropLife Canada, and I've also got producer funding through the commodity organizations Sask Barley, Sask Canola, Sask Wheat, Alberta Wheat, and the Canadian Canola Growers. So it's a public, private, and producer partnership, and it's a really fascinating and interesting. It's the only research chair like this in Canada that's got public, private, and producer partnerships in a social science setting. So I'm so thankful that all of the stakeholders in my research chair and the University of Saskatchewan are open to innovative ideas about how to set new research chairs up and be involved in innovative research. So it was a lot of fun to be invited to talk about something that's not in the mainstream media or on social media much, but to talk a little bit about some of the things that simply don't appear much about. Sort of what are some of the human health and social benefits around genetically modified organisms and crops. And so as has been mentioned tonight, this is the 2020 is the International Year of Plant Health. And what that means is it was designated as such by the United Nations and the Food and Agricultural Organization. And the objective of having an International Year of Plant Health is to try and promote awareness on the importance of plant health in terms of providing economic development, helping to protect the environment, and finding ways of reducing poverty and also mitigating hunger. So without plant breeding, none of those objectives would really be possible. Plant breeding over the last 150 years has allowed us to transition from frequent and common famines to them being very infrequent and the result of adverse climate or weather conditions in very localized regions. It's virtually unheard of anymore where we have very broad region or countrywide famines in the last couple of decades. So the result of that is through investments in plant breeding and crops that are able to be more tolerant to drought or to heat and that have higher yields. And so that's the objective of my talk, is to talk a little bit about some of the breeding technologies that contribute to some of the objectives of the International Year of Plant Health, to talk about how genetically modified crops are helping with economic development, protecting the environment, what they can contribute to poverty and hunger mitigation, but also to spill over into some of the areas of health and social benefits. So genetically modified crops have been grown in Canada for 25 years. The first year that they were produced in the prairies was 1995. So Canada is one of the earliest adopters of GM crops, and we have some of the richest history and absolute wells of information about the benefits and the safety of this technology. And that gives me a real advantage to be able to work with farmers, to survey them, to measure what's going on their farms, and to be able to write that up and publish this literature and make it available for policymakers and people that are interested to come along and read some of this. So I do publish a lot of my research, so I'll give a bit of a plug to one of the outlets where I publish a lot of my information. I have a weekly blog that's published as Safe Food, so it's SAIFOOD.ca, and that stands for Sustainable Agriculture, Innovation, and Food. So GM crops are grown in 26 countries around the world. They're imported by another 44 countries. So 70 countries around the globe have done risk assessments, and over the last 25 odd years, there's been over 4,000 risk assessments done on genetically modified crops by governments in the Americas, Europe, Asia, Africa, the Middle East. And not a single risk assessment has ever found that the risks of producing a genetically modified crop are different in any way from the risks of producing a conventional food or non-GM crops. So that's how our regulatory and the risk assessment system works, is it compares new genetically modified crop varieties to existing crop varieties, and if the risks are equivalent, then the varieties have been commercialized. In Canada, the majority of the genetically modified crops grown here are canola, corn, and soybeans. But we're starting to see an increasing number of directly consumable crops or food products, becoming available. If not on the market already, they'll certainly be available within the next year or so. So we've had genetically modified papaya be available for 20 years. Genetically modified potatoes, apples, salmon are available within the next year or so. And Canada's also approved genetically modified rice and squash, and it's doubtful that those are showing up on store shelves here because they've been commercialized in other parts of the world. But one of the important things about the production of genetically modified crops is in a lot of food insecure countries, we're seeing GM crops be rapidly adopted and widely adopted by farmers, and consumers are having no reservations about purchasing these food products. There's examples of genetically modified cowpeas in Nigeria, genetically modified rice in the Philippines, genetically modified eggplant in Bangladesh, and all of these are helping to improve food security in developing countries. So annually, there's a report done every year that tries to look at what the global impacts from genetically modified crops are, and they publish this in a peer-reviewed journal. And the report was released in July, and what the report cumulatively looks at is the impacts of genetically modified crops between 1996 and 2018. And they found that over that 22-year period, the amount of additional food that was produced was 824 million tons. So that's a significant impact over, just over 20 years, to have over 800 million tons of food produced that simply wouldn't have been produced without genetically modified varieties of those crops. Corn yields were up by 16% and soybean yields were up by 10%. So certainly significant contributions in terms of contributing to reducing food insecurity. The net global increase in farm income from GM crop adoption has been estimated to be $225 billion over that same 22-year period. And interestingly, those benefits are virtually equally split between farmers in developing countries and farmers in developed countries. So farmers, as I mentioned, in Nigeria, in the Philippines, in Bangladesh are receiving an equal distribution of the benefits as those in Canada and the United States. So I think that speaks a lot to just how globally or how global the benefits from this technology are appearing to be. there was a study done a few years ago that did a sort of a summary of published studies over the first 15 years of genetically modified crop adoption, and it estimated that the global average of increase in farmer profits was nearly 70%, so 68%. So that's a significant increase for farmers in developing countries that may only have 2 or 3 or 5 acres of land to have a nearly 70% increase in their farm profits for the year. Provincially, I did some work looking at what the impacts of genetically modified canola were to canola farmers in the 3 prairie provinces after the first 10 years of GM crop adoption, and we were estimating at that time it was almost $400 million annually. So we're curious to see what the situation is after 25 years, and I'm pleased to be able to announce that just this week we got approval from the university to go ahead and redo this survey. So we'll be rolling it out at venues around the province over between now and Christmas, and in a year from now we'll be able to roll that out in Alberta and Manitoba. So if any of you are in the farm community, we hope to see you at one of the workshops that we'll be holding either this coming winter or the following winter. So what are some of the environmental benefits from genetically modified crops? The same study that looked at the impacts between 96 and 2018 has estimated that 776 million kilograms less in pesticide applications has been a result of the reduced pesticides from the adoption of GM crops. So that's about a 19% impact in the environmental, the impact of chemicals when applied to crops. And with fewer field passes, they've also estimated that there's about 23 billion less kilograms of carbon dioxide reduced as well. So if you convert that to vehicles being on the road for a year, it would be equivalent to removing 15 million cars from the highways in Canada for an entire year. So that makes a significant impact on agriculture's ability to help mitigate some of the impacts from climate change when agriculture is making fewer emissions. And I think the removal of tillage, so one of the big things we've seen in agriculture across the prairies is that in the early 90s, there was around 15 million acres of summer fallow just in Saskatchewan alone. And for 2019, it was down to 1 million acres of summer fallow. So the excellent weed control from herbicide-tolerant crops has allowed farmers to no longer till their land for weed control. And I think it's made genetically modified crops have contributed to some of the most sustainable crop production systems practiced anywhere in the world are being practiced by farmers right across the Canadian prairies. So we know that when farmers no longer till their soil, it means that there's no carbon released into the atmosphere every time they till the soil. And farmers have been telling me that when they started to adopt genetically modified crops in the late 1990s, they've been able to keep the majority of that land in continuous zero tillage. And so it's been sequestering CO2 for 20 years. And that makes a significant impact on agriculture's ability to mitigate climate change. One of the really interesting things is there's some research and it's being led out of by a research team in Indianapolis. And what they're looking at is they're trying to increase the plant's ability to sequester more carbon as it grows. And they've been working on this research for several years now. And I happened to be at a conference in Europe about 3 years ago, and I was talking to some environmentalists there, and they, they were pretty upfront with me. They said, we don't believe in genetically modified crops, and can you explain why they're so popular where you're from in Western Canada? So I walked through sort of what our agriculture situation looks here, that the size of our fields and the size of our equipment and the way we've been able to remove tillage and the simplicity of large-scale farming and how genetically modified crops fit into that. And I started to talk to them about the research around the ability to sequester more carbon. And I asked them, I said, so if you could put a tree or even, let's say it gets into flowers or shrubs, and you could plant something in your own yard that would sequester more carbon than a non-GM version would you plant that in your yard? And they all paused it out, the group I was talking to, and they said, we had no idea that science was getting to that level, that it could help reduce climate change, and I could put something in my own yard that would make an impact. And most of the group that I was talking to said that would be a game changer. They would have to think whether they would still be opposed to genetically modified crops if they could plant them in their own yard and know that they were making a contribution to reducing greenhouse gas emissions. So one of the most significant human health benefits that I think has resulted from the adoption of genetically modified crops is relates to the adoption of BT cotton, or genetically modified cotton, in developing countries, especially India and China. So when you've seen farmers spraying fields here, they have big high clearance sprayers that are going along, and the farmers with the protection equipment now, they never touch the chemicals. Yet in developing countries, cotton crops are sprayed by hand. So you'll see quite often women or children walking through a cotton field where it's about waist high. They're wearing shorts, t-shirt, flip-flops because it's a hot day, and they've got a backpack sprayer, and the wand just goes back and forth across the row of cotton that they're spraying. And so as the leaves brush against their arms and their legs, the skin absorbs some of the pesticides that they're applying to their crops. And this results in pesticide poisonings then. And so some research that was done about 5-6 years ago by a colleague of mine in Germany estimated that in India alone, BT cotton was reducing the number of pesticide poisonings by anywhere from 2.5 to 9 million cases a year, which saved the government $15 to $50 million in no longer having to spend that money on healthcare costs. And if you take that forward, India commercialized GM cotton in 2003. So over the last 15 or 16 years, I've sort of extrapolated some of that research, and I'm estimating that anywhere from 40 to 150 million fewer cases of pesticide poisoning have happened just in India alone. And so I think, the fact that farmers are no longer getting sick, farm wives and kids are no longer getting sick from having to spray chemicals. Because with cotton, it wasn't just a one-time application to control the insects. Farmers were spraying their fields, depending on how bad the insects that were attacking their cotton plants were. It could be anywhere from 10 to 25 times a year. So these crops were being sprayed every week, or in some instances twice a week, just to keep the insects away. So it's a significant benefit in terms of the human health aspects. One of the other aspects that I think is equally important is some of the research out of India, again, found that the suicide rate in Indian farmers was one of the highest in the world. And this was due to a combination of factors: poor weather, poor harvest, poor yields, high interest rates, the lack of access to capital. But some researchers out of Europe took a look at the suicide rate and looked at the relationship to the commercialization of GM crops, or GM cotton. And when they extrapolated past the point of when they did their study in 2011, they found that the suicide rate in actual numbers was 1/3 lower than what it had been trending to between 2001 and 2011. So their hypothesis was that the higher yields and the higher income from genetically modified cotton was reducing the stress for Indian farmers. And they estimated that over the last decade, between 2011 and 2020, it's possibly resulted in the prevention of 75,000 farm suicides in India. So So again, significant human health benefits that I think are a message that needs to be more widely communicated, but regrettably is just falling on a lot of deaf ears when it comes to mainstream media. So some of the other human health benefits is there's some research out of China looking at the adoption of GM cotton there and the reduction in pesticide applications, finding that there's a correlation to reduced liver cancer, reduced nerve damage. There was also a study of looking at 20 years of data of genetically modified corn consumption. So one of the benefits of genetically modified corn is that it reduces insects' ability to successfully attack the corn. And when insects attack a cob of corn, if you've purchased corn on the cob in your life, you've probably stumbled across the odd cob that when you go to husk it, you'll find there was insects got into it and the tip of the cob has got mold on it and has been damaged. Well, those are mycotoxins. So when an insect bores through the husk and into the cob, it opens up the cob to these mycotoxins that are airborne toxins that when the hole, after the toxins follow the insect into the hole and they start to infect the cob. And these mycotoxins have correlations to both esophageal cancer and liver cancer. And the research on genetically modified corn data found that there was a 30% reduction in the mycotoxins that are linked to cancer from people being able to consume genetically modified corn. So again, significant human health benefits. And there was some really interesting research done a few years ago at the University of Alberta, and they were looking at some genetically modified, at a variety of flax that they had genetically modified to change some of the fatty acid profiles. And they discovered that when they were using it as a treatment mechanism for breast tumors, it was able to reduce the size of the tumors by anywhere from 80 to 85% in size. So some significant human health benefits in terms of abilities to not only prevent, but in some cases reduce cancer as part of our daily lives. So there's not been a lot of studies that look at GM crop adoption and poverty. The only one I've been aware of was a study that was done about 7 or 8 years ago. And again, it looked at cotton adoption in India. And it found that the highest level of benefits were accruing to households that were defined by the Food and Agriculture Organization as households that live in extreme poverty. So according to the FAO, extreme poverty are those households that live on less than $1.25 a day. So if you manage to go out to Tim Hortons or Starbucks today and buy yourself even a medium-sized coffee, you spent more on coffee today than some of these Indian households would have available for food, for living expenses, and for everything else. But this research found that these households in extreme poverty, when they adopted BT cotton, had their annual household income increase by 134%. So an absolute huge turnaround for these households that live in extreme poverty day in and day out. So some of the really interesting things are moving towards gene editing, which is a new method for breeding and developing new crop varieties, and it's really a targeted mutagen that allows plant breeders to specifically change the function of genes. And one of the most important and I think appealing benefits to come from this is the ability to increase the nutrition of certain plants. And the reason this is important is one of the United States National Cancer Institute has estimated that cancer deaths and diet are related, and that 5 out of 10 people in the states that have cancer are the result of some nutritional deficiency in those people's diets. The World Health Organization estimates that about 5 million children a year under the age of 5 die annually from effects related to nutritional health aspects. In a lot of cases, it can be due to stunting, where children just simply don't get the required amount of nutrition on a daily basis, so it stunts their weight and their growth. But there's a technology, and sort of the name that's been coined for this is biofortification, where they're improving the nutrition aspect of crops. And a long-running example of this is the ability to increase vitamin A in golden rice. But that's just one technology. There's been multiple crops and research. So for example, there's been research looking at ways to increase protein levels within canola, corn, potatoes, rice, soybeans, wheat. They're changing the healthy oils, so that the good oils from canola, but that's also happening in cotton, flax, corn, soy, and safflower oil. There's research going on looking how to increase the vitamin aspects of corn, sweet potatoes, rice, strawberries, and tomatoes. And then also a bit of research looking at how to increase the mineral availability in things like lettuce, wheat, corn. So there's research happening all over the world with all kinds of bulk scale commodities, but also some of the garden type crops that we would be able to grow in our own yards as an option for it, simply having the ability to increase the nutritional content of the foods we're eating on a regular basis. So one of the things that really fascinates me, but unfortunately there's just not a lot of information in this, is the relationship between education and improved crop production. So there is a lot of research that's been done in developing countries that correlates higher levels of education to improved crop production, such as to the point that if someone goes to school for 4 years, they estimate that it has the ability to increase farm productivity by almost 10%, 8.7%. So about, just a fraction over 2% per year for every year that students are sort of able to stay in school a little bit longer. One of the really interesting things that I've been trying to take a look at is to see if there's any evidence that would suggest that the adoption of GM crops that are having a higher household incomes, because in a lot of developing countries, particularly young female education depends on how much money there is in the household, and households that have higher incomes have money then to send their daughters to school to get more education. So the website that reports a lot of this information in the UK reported that between 1998 and 2014, the number of female students that were not attending school dropped from 64 million to 32 million. So it was cut in half over a 16-year period, which I think is a fantastic trend. And unfortunately, it's still 32 million. Essentially, the entire population of Canada, as young females in developing countries, are just simply not getting any education. And one of the really interesting ones comes from a presentation I saw a few years ago, and it was a woman who started growing BT cotton in 2013 in South Africa. And so she started with about 10 acres. And she said that after 4 years, it was so successful that she'd been able to buy and lease more land. She'd gone from the 10 acres she started with, and she was up to 100 acres. But one of the most important things is she was able to pay for her sister's education. So I think for me, that's a real telltale sign, is that as individuals are able to get more education, they're able to increase their opportunities in life, to get better paying jobs, to have an alternative to get themselves out of poverty and extreme poverty. So I think this is an area that needs a lot more research, and if there's the potential that GM crops or the increase in household incomes, if that's having an impact on increased rates of education, then I think that's a really important piece of research that needs to be undertaken. a friend of mine who was doing his PhD about 10 years ago in South Africa was looking at some of the social benefits of GM crops. And so he was surveying predominantly female landholders, because they're the ones that do the hand weeding for the crops, or particularly with GM corn in South Africa. So over a 3-year period, he was surveying them. And what he found is farmers in South Africa are able to produce 2 crops a year. So over a year, women were able to spend 3 weeks less time hand weeding. So then he followed up that and asked them, so what did you do with this additional time that you had? And the women reported predominantly 2 things. They said they were able to have a larger vegetable garden, which was used to feed their family, so it helped improve their household food security. As they were able to have a little bit more time to have the larger garden, they also had time to haul more water to the garden, which increased the productivity of their garden. But it also allowed them to spend more time with their children. And for me, I don't really think you can place a value on how much time you want to spend with your children. And sure, fair enough, they're cranky and frustrated at times, and you probably wouldn't place much value on that. But for the most part, that's almost a priceless thing to try to estimate, is the value that we get from spending time with our kids. So when we go back to look at the objectives of the International Year of Plant Health and what the United Nations Sustainable Development Goals are, the first 4 of the goals are to end global poverty, to end hunger, achieving food security and improving nutrition, to ensure healthy lives, and to provide an equitable and quality education. And so the thing that really strikes me is that genetically modified crops are making a significant contribution to all 4 of those sustainable development goals, and is certainly contributing to the International Year of Plant Health. And as the research progresses with gene editing, and we're able to see scientists putting technologies to improve nutrition, not only into the large bulk crops like canola and corn and soybeans, but also the crops that we would, or the food products that we would start to consume on a daily or weekly basis, like lettuce or tomatoes or potatoes, apples. I think what we'll see over the next 10 to 20 years is an absolute revolution in how healthy our food's going to become. And that may have all kinds of lifelong implications for not only those of us in developed countries, but particularly those in developing countries, where particularly the first 5 years of life, those children just simply aren't receiving enough nutrition on a daily basis. So as I said, with this being the International Year of Plant Health, I think that genetically modified crops are making a substantial contribution to economic development, to protecting the environment, reducing poverty, and contributing higher yields. Farmers are having higher household incomes, we're reducing greenhouse gas emissions, and households with extreme poverty are reporting higher levels of benefits. And the higher yields are as well helping to contribute to improved nutrition. So that sort of wraps up the thumbnail sketch that I wanted to try to touch on this evening. And I hope I've made you think about some things. And if you've got questions, I know I skimmed through some of this kind of quick. And if I didn't go into enough detail and depth, and you've got something you want to throw my way, I'd be more than pleased to try and answer your question. And as Julia mentioned, if I don't do a good job or you don't get to it, feel free to reach out to her and she can direct the question to me this evening or tomorrow. And if you want to provide your email address, I'm more than happy to try and get back to you that way too. Thank you very much.
Hi, Stu. It's Christy Morrissey here. I have a question about, or just have you comment further a little bit about a description you gave about the sort of decrease in pesticide use in response to GMOs. And I certainly have no doubt that there's been benefits to growing more crop more simply, and certainly reducing the amount of summer fallow. But the comment about decreasing the overall pesticide use, I'm wondering where you're getting that information. We recently did a study to analyze the Canadian Census of Agriculture, and for example, herbicide use in the prairies since 1981 to the most recent census year has doubled. And much of that is attributed to GMOs. So maybe you could just comment a little bit more on that issue. Thanks.
Sure, Christy. So you're right, with the removal of, in Saskatchewan with 11 million acres less summer fallow and crop down, overall, we use more chemicals in agriculture than we did 20 years ago, for sure. So where I get those numbers from is we surveyed farmers in 2005 and 6, and we asked them to compare their chemical use prior to 95 to what they were doing 10 years later. And the canola acres between those 2 years were within 100,000 of each other, around 10 million acres. And farmers indicated that they were using about 1.4 million kilograms less active ingredient on roughly the same number of canola acres. And the thing that really changed, Christy, was that prior to herbicide tolerant canolas coming out, there was not a chemical that provided really effective weed control in canola. Canola was pretty sensitive to chemicals. So a lot of the chemicals that had to be used were required to be soil incorporated prior to seeding. And so some of those had a relatively high level of environmental toxicity. And when we looked at the change between the top 5 chemicals that were used on conventional canola prior to 95 to the top 5 chemicals being foliar applied in 2005 and 6, the environmental impact of those chemicals dropped by 52 or 53%. So a huge impact, not only for producers and how much chemical was being applied to canola, but to the environmental impacts of the chemicals that were being applied.
Hey, and sorry, Christy, I see you unmuted yourself. Is there anything else that you wanted to add?
One of the comments maybe I'll just make is that, about the active ingredients, most of the farmers are not reporting, for example, their insecticide and fungicide use accurately, now that, these are seed treatments as rolled into that, rolled into that sort of chemical package that they're using for GMO crops. So perhaps the reporting isn't accurate in those cases, but nonetheless, yeah, I think there's further work to be done.
Yeah, and that's why we're doing the survey again this winter, Christy, is to survey farmers on their land management practices to better identify, what the benefits are, to quantify them, but also to highlight some areas that could be problematic. So if farmers are growing canola on canola, then we know that that's going to be a potential, and any implications that might lead to the increase in herbicide resistance within weeds is again a crucial sustainability issue that we need more information on.
It's a question for Stuart. Stuart, got an opportunity here to speak to the Committee for World Food Security coming up in October here. And it strikes me as strange that the ideology at that level is really moving towards the words of agroecology and regenerative. And of course, that's to the exclusion of anything to do with genetically engineered crops. And so we have a massive movement ideologically with agroecology and regenerative, and again, to the exclusion of genetically engineered crops. Any comments on how we can bridge those gaps and bring them together? Because I think that we're more sustainable with the science than without.
That's a great question, Rob, and congratulations on being able to speak to that event. It's good that there's going to be somebody that's knowledgeable about modern innovations in agriculture to be able to present there. I think we're globally at a turning point. Europe is treating all the new technologies, all the gene editing technologies. They've said all of these technologies have to be regulated as equivalent to GMOs. And so that's creating some hesitation in African and Asian countries whether they should allow gene editing. But virtually all of the COVID vaccine and testing is being done using gene editing. And the EU has actually had to derogate some of their regulations to allow the development of vaccines. So Europe, within the next, let's say, 6 to 12 months, is really going to have to figure out how opposed they are to innovation, because you can't have the scientific principles for a gene-edited vaccine be regulated differently than the scientific principles of a gene-edited plant. Or if they do, then they've confirmed to the rest of the world that their regulatory system is based on politics and science no longer matters. And then governments in developing countries can see what Europe is basing its regulatory system on and move away and rely on science-based. So I'm hopeful, Rob, that by the time we reach this point next year, that there's been sort of a transformation as gene-engineered COVID vaccines are rolling out, that Europe has adopted one system. They've moved away from this ridiculous position that gene editing is with no foreign DNA is equivalent to GMOs, past the peak of rejecting safe technologies and innovations, and can allow farmers to have the choice. Because you're right, so much of it is designed to keep modern innovation out or prevent it from being commercialized. And all farmers are asking for is the opportunity to compare. As intelligent business owners, every farmer that I've ever spoken to, regardless of what country I'm in, they know they can tell you after the first year whether the technology is going to make them more money or cost them more money. And those that cost them more money, we've all seen that those aren't successful technologies. So the fact that GM crops have been increasingly adopted for 25 years, farmers are definitely experiencing benefits from it.
Just wanted to respond to Christy for a minute, and she's made some points. We may have, and I work with a lot of farmers, we may be seeing some, there's two sides of the story. We may be seeing some overall pesticide use increase, but that's because our canola yields, for example, have gone from 30 to 60 to 70 to 80. So we are using more fungicides now to protect a crop that's much higher in yield than we used to. That's true. The paper that I provided from Ontario data looks at an important distinction, and that's active ingredient per acre. And I think that that's an important one too. And environmental impact quotient is another one. So the environmental impact quotient of Roundup, for example, is much lower than trifluralin worked into the soil. So those are just some things. This is a nuanced point, but I wanted to make it.
When you ask questions to those who do not want GM crops, do you ask them if they refuse healthcare treatments like insulin, medications, cancer treatments?
No, I don't go that far. And I will highlight that insulin is derived from a genetically modified process. But typically I try to frame it within the aspects of looking at benefits to farmers in developing countries, and say, lots of times, talking to people that are opposed to GM crops in industrial countries, Canada, the States, and Europe, and say, look, we're food secure. We have the luxury of deciding whether or not we want to consume GM conventional products or organic or whatever allocation of the three that you choose. But a lot of people in developing countries just simply don't have enough food on a daily basis. So are you opposed to genetically modified crops being grown and consumed in your own country or globally? And it forces people to at least acknowledge that people in developing countries, a lot of cases, they would just like more food. They don't care what method was used to produce it.
The next question from the chat is, please talk a bit about the economics of people in developing countries using GM seeds. Are the seeds more costly?
They are. So whether the technology comes from a private company or from a public research institution. So for example, with genetically modified cotton in India, it was first commercialized with a partnership between Monsanto and Mako, an Indian company. But there's now over 40 different companies and public institutions that have commercialized varieties of cotton, and all of those seeds will have a little bit higher price. There's no, for sure. But as I said earlier, farmers are smart business people, and they're after a year they can figure out if the amount of money that they paid in extra cost to buy the seed, if they don't make that up through lower chemical costs or through higher yields, they're not going to pay the additional money to buy those seeds the following year. So that's where farmers have, there's about 17 million farmers globally growing GM crops, and again, sort of equally split. So about 8.5 million farmers in developing countries have had that opportunity to pay a little bit of extra money to get genetically modified seeds, and have concluded that at the end of the season, they're economically better off for having done that.
Is anyone looking at effects, actual or potential, to alter gut microbiome and thus health? Because that's a really new burgeoning area of research, is gut microbiome.
Right. So genetically modified crops are regulated in Canada according to 3 acts. The Seeds Act, and so that looks at aspects of the seed, its ability to impact biodiversity, weeds, those types of things. The Feeds Act, it looks at it from what impact is it to livestock that get fed it, and then to the Food and Drug Act, which looks at our consumption. So what that does is it looks at whether a genetically modified crop has the ability to become an allergen, or whether enough consumption of it would be toxic to humans. Does it have impacts on our metabolism? So the research would be done as part of a risk assessment to see what impacts would be occurring during that digestion process to track any of those types of aspects. It's beyond my area of scientific expertise to talk about interactions with gut microbiomes, but from a regulatory perspective, that would be included within the risk assessment as defined by the Canada Food and Drugs Act.
Okay, thanks, Stuart. The next question, if you're ready for another, is can you elaborate on how GE flax reduced tumor?
If I recall correctly, what they were doing was they were modifying the flax to change some of the what they call PUFAs, polyunsaturated fatty acids. And my recollection is it was a drug trial that they were doing. They were using the modified flax oil as a potential treatment for cancer tumors. And so the way they were conducting the experiment, they found when they were using mice or rats, one of the two. I'm sorry, I can't remember which one the trials were with, but they found that when the rats consumed the modified flax oil, it actually shrank the tumors that the rats had as part of the drug part of this trial.
Unfortunately, GM crops have now displaced the conventional crop seeds, and these are not able to be obtained currently. Any comments?
That's not quite accurate, because, as I said, genetically modified crops are really only in the large commodities of canola, corn, and soybeans, and there's still public research institutes in Canada and the States that are developing conventional varieties. all of the other commodities, oats, barley, wheat, they're all still developed by public breeders. Some private breeders are in there, but no, farmers still have the option to decide whether or not they want to buy a technology from a private company and pay a higher price, or still pay a lower price and buy a variety that's been developed by a public institution.
And I have a follow-up in the chat about the gut microbiome question. So if you're okay, I'm going to ping you back to that.
You're the one that works in medicine. You should be answering these.
Not gut microbiome, although it's a hobby interest. I think it's well cool. I was really thinking more of, so follow-up point on gut microbiome. I was really thinking more of intentional effects to support or improve health, maybe even treat illness, not causing harm. Food would be medicine.
Oh, that's interesting. Okay. So I've not seen any research yet that looks at sort of the health linkages between something that, let's say, would be a biofortified crop that might have more nutrition, and what the impacts on the gut microbiome would be. I just simply haven't seen any of that come across my screen at any point in the last few years.
A comment: there is a difference between hybrid seeds, they are purchased everywhere, versus OP, which is open pollinated crops such as wheat or barley that a farmer can save in their bin for reseeding.
Right. So the hybrid seed technology it dates back to the 1950s, and it was first developed in corn. So the offspring of a hybrid plant are sterile. So if you had hybrid corn, you'd have to buy new seed on an annual basis, simply because the ability of that hybrid seed to generate the next year would be so low it wouldn't be economical to replant it. So hybrid technology and farmers repurchasing seed on an annual basis is something that's been common to agriculture for over 60 years. But Rob's right that open pollinated varieties, a farmer can grow the seed or plant the seed, harvest it, and then turn around and replant that seed for as long as they want to continue to do so.